was diagnosed with breast cancer at 43. My first thought was, am I going to die? I remember asking my husband if he thought I was going to die, and he said, I don't know the answer to that, Sonny. My surgeon was very supportive, and she reassured me that surgery was the first step I needed to take, and then radiation would be the second step.
Dr. Gentile was monitoring me. My last PSA was high, and he did a biopsy and discovered some cancer on one side of the prostate. He thought that radiation would be the way to go and referred me to Dr. ZHANG. Dr. ZHANG is very reassuring, so I had great confidence in her.
We at Highland Radiation Oncology offer comprehensive treatment, even though we're in a small community setting. Our physicians, our staff are working affiliated with really a top-notch medical center, top-notch cancer center, so we can provide multidisciplinary, compassionate patient and family-centered care.
Debbie's getting a nice warm blanket. Oh, thank you.
As a radiation therapist, we are with the patients probably the most of anyone. We see them 5 days a week, anywhere from 2 weeks to 6 weeks to 7 weeks. I always say it's trying to make a terrible thing not quite so terrible. The linear accelerator can be very overwhelming, so you really have to think of how they're feeling when they walk in and see that and go, whoa, you know, that's a big machine there. So we just try to go step by step what's going to happen and let them know ahead of time.
Okay, we're going to go out, we're going to leave you in here, you'll hear us. Every single time they told me that. Everything that they were doing, which was so reassuring.
Here we go, just about ready to begin.
All the people have been wonderful, the staff and the nurses, the technicians. It's almost like stopping in to see some friends for a little bit.
I'm so very excited that renovation is going to start, because at this moment, it is really a long walk before they come to our treatment areas, more than 500 feet. That's about 2 football fields they have to travel through before they reach to us.
These patients that come back with metastatic disease, they're in pain, and you can read that in their face. So they deserve a better entrance to get to us and a prettier facility. Our charm can only go so far.
But you get off the elevator and it's going to be right there. The waiting room is going to be right there, and the machine where they're going to be treated is practically around the corner, as well as the dressing rooms. It's going to be much quicker and much easier for the patients.
Each one of our patients individual is a person. They come with families. That's why we renovate. That's why we want to upgrade our technology. We really want to be at the leading edge.
Making those changes for future patients is going to mean there's a matchup between the warmth of the staff and the warmth of the environment. It makes it less intimidating, less fearful. The more something can seem like home, I think the more successful people are in their healing.
The 2 months have gone very fast. I was telling my wife I'll probably miss coming for a while.
People ask me how I work there, and it's not always what I give, it's what the patients give to us. I love my job.
If I had the staff in front of me right now, the first thing I would want to do is give them a huge hug. I mean, that's how I feel about them. I love them. They treated me so good, and they reassured me at a time that was very uncertain for me. Thank God they're there.